Welcome everybody to another edition of Amplify Your Business. Today we're going to be talking about rehabilitation science, which is going to be really, really cool and something different for this show. And so with me today is Jana Rieger from True Angle, and you have an incredible piece of technology that you've developed over the years. So why don't you tell us a little bit about the company, and then we'll get into kind of the backstory of your entrepreneurial journey.
Sure, sounds good. So the company True Angle is a health tech company. The base technology is around sensors and finding a way to have a software solution that provides easy, accessible, home-based health technology for patients. The technology that we're focusing on is around people who have swallowing disorders, which the medical term for that is dysphagia.
Okay. Now, this is something that I didn't even know existed until I came across your company. And so how common is this in terms of an issue where people are struggling with swallowing, and what would create that challenge, I guess?
Yeah. Well, first of all, it's not unusual that people haven't heard of this. Which is surprising because it's a super common disorder. So 20% of adults over 50 have had some experience, have had diagnoses of dysphagia.
Really?
So when you think about how many people is that around the world, it's about 500 million people around the world.
That's incredible.
Yeah, it is. And the part of the reason that it is so high is because it's associated with medical conditions that are pretty common. So things like stroke, Parkinson's disease, head and neck cancer. And, you know, a lot of us have heard about these things. I'm sure your listeners will say, oh yeah, I know someone who's had a stroke, or I know someone with Parkinson's disease. What they might not know is that there's all these other things that happen with those diseases, and dysphagia is one of them. And interestingly enough, it's not very often talked about, and it's kind of this silent thing. And I'd actually reached out to a Facebook support group that had patients who had dysphagia on it. And I said, hey guys, is it just me, or does it seem like not a lot of people know about dysphagia? And I just got all these responses back about how even their own doctors really didn't understand it or know about it. And so I think a lot of people keep it silent. There can be a lot of embarrassment around it because it involves eating, and now they can't eat properly. They can't do these usual social things like going out to eat and having a drink with friends. If they do, they're at risk of choking and causing, a big scene. And so it tends to be this thing that a lot of people just don't talk about, and so therefore you and I don't hear about it and don't know about it.
So now there must be quite the degree of I guess infliction or cases, right? Because I would imagine with that number of 20% of the adult population, not all of them are in a situation where they can't swallow at all. It's somewhat problematic, but not inhibiting completely, or like walk me through what that looks like. Because when I hear people having trouble swallowing, I think like, well, how do they eat and how do they really function? But there must be quite the range then in ability.
There is. There's a wide range of abilities and disabilities around it. So it can range from everything from the feeling that food isn't going down the right way, but it eventually does, to food goes down, but it goes into your lungs and you're choking on it, so you can't eat by mouth. Some patients can't eat solid food, but they can put all their food in a blender and try to drink it. Again, with the risk that it might go into their lungs. If it's so bad that you can't eat anything by mouth, there are patients who have to get a tube in their stomach, and then they get tube feeding essentially to sustain their health and nutrition. But there's still lots of problems with that, where obviously the biggest one, which is you're not able to enjoy food, but also you can still have problems with food and reflux coming back up and then it going into your lungs still. So it's really a tough situation. So there's a lot of life-altering consequences related to dysphagia.
Okay, so then at what point did you decide that there's a business here that you wanted to start to try to solve this issue?
Yeah, so I'd been working as a clinician researcher at an institute in the city. We were treating patients who had either head and neck cancer or traumatic brain injury, some congenital conditions, but mostly head and neck cancer. And what I was seeing when I was working with patients who had this problem was that they had been treated for cancer. They had gone through these really grueling treatments for this, and they had survived the cancer, but now they were left with this problem called dysphagia, and it was blowing their lives apart. And we had been researching all different ways that we could help. Are there surgical techniques that we could use to make this better, prosthetic techniques? And one of those techniques was behavioral intervention, so exercise intervention. And so I'd started a trial where it was an intensive therapy trial. Patients would come into the clinic, the hospital every day for at least 6 weeks. And I had to close the trial because just nobody could commit to that amount of time driving in and out of the clinic every day to get hooked up to this machine that would help tell them about their swallow.
Okay.
So that was the genesis of this. And then I had a couple of folks who were working at the hospital with me. One was a speech pathologist who was working in my lab, Gabby Constantinescu, and a biomedical engineer, Dylan Scott. And one day they're having lunch and Gabby said to him, can't we make this big, huge machine smaller and give it to patients so they could take something home? Yeah. And that's where things started. So we started prototyping. I started hitting the pavement trying to get money, which is always, you can't do any of this stuff if there's no money, right? Yeah. So maybe that was the beginning of the entrepreneurial journey, but that was in academia. Okay. And so we had done all these studies. We got to the point where we had an MVP that we were ready to test on patients. We had patients and clinicians work with us on our team as we were developing all this. And we knew we had something that worked. So then it was like, okay, so this is in the lab, now what? Like, how do we commercialize this? And that's where, it took a little bit, but I realized that if we were going to do anything and get this into the hands of the public, I was going to have to do it. So that was the big jumping off point. But for me, it was, if you look back on where the entrepreneurial journey started, it was when I was a kid. I was always interested in business and, how to make money. And I watched a father who was very entrepreneurial. And so I always had that in my blood. And I'd say after each degree that I finished, I thought, maybe I should go into business. And then something would pull me back into the clinical science realm. And then I'd be like, maybe I should go into business and again. So, really now this is, it's an amazing journey for me because I've been able to blend both that clinician science aspect that I really loved with this entrepreneurial drive that I've always had.
So a question for you on the drive, the entrepreneurial drive. Does that come from a place of, just building a business? Or does that come from a place of trying to solve a problem? Like what is actually the drive for you? Because there's different, some people want to be the richest man in Canada or woman in Canada, right? Other people want to make a difference. And so what drives you when you say I had the entrepreneurial drive?
Yeah, I love that question. And I'm not sure. Like I said, when I was a kid, I loved money. So there was always that. But with this, that's not it. As I've said, I wanted to get this into patients' hands. So there's this desire to help people who we've seen have been marginalized by this disease. But I think what really drives me is creativity and the creative process. And what I've found over my life is as soon as something becomes too routine and like every day's Groundhog Day, I can't do that. Yeah. So for me, what I love about this in the startup world is like, there is no one day that is same as the day before. And you're always trying to solve something. You're always trying to move the needle and move ahead. And there's always new people with really great ideas coming in. And so that's what gets me going and makes me want to continue to see this succeed.
Yeah. I echo that. For me, I would probably say the challenge. I love the challenge. Each day, like you said, is completely different, and you're building something, you're creating something, which is really cool. You're solving problems, which is really important to me. But it's really the challenge of like, I can figure this out. I can make this happen. So yeah, like I love the story where you're like this giant machine that you're trying to figure out a way to condense that down into something that people can take home. And we'll take a look at the actual what you have condensed it down to, which is absolutely remarkable, knowing the history of what you started with. But right now, I'd love to have you just explain a little bit along that journey that you've been on with this particular venture. How long has it been now? From that day when you were thinking of the idea to the time where you get the prototype in hand to today? What kind of...
Thinking of the idea was around 2013.
Okay.
I started applying for grants. We were fortunate to be funded by the Alberta Cancer Foundation. They gave us a $2 million grant over 5 years to do the work. And so that really allowed us to bring the team together that we needed. And then around 2017, we're about halfway through that grant, and things started popping up that research grants won't pay for. So things like IP protection. So it's like, okay, how are we going to pay for this patent?
Yeah.
And it's like, well, that really is a commercial issue. And so I was like, okay, well, I know there's some commercial grants out there, but first I have to have a business. So that was on paper. We started in 2017.
Okay.
And the idea there was to get some of these business grants in. But then what I learned pretty quickly was you just don't get business grants. You have to have something in the company first for that non-dilutive funding to come in. So I did a bit of bootstrapping there and got a little bit of funds to come in initially.
So kind of a friends and family.
Yeah, sort of. It was mostly Jana at that point. No friends and family. And then we were fortunate enough to be part of the Creative Destruction Lab Accelerator.
Oh, yeah. Okay.
And so that was where we really got some of the grooming around what it meant to come out of academia and into entrepreneurship. And started learning about all the things we were going to have to learn about, and what it meant to be entrepreneurs in a business and how that was different. So we were very, very fortunate to have some great mentors there and go through that program. And at that point, then we raised a pre-seed round, enough money to get us to market. Essentially, was our goal at that point.
So when did you get to market then?
The best time you could ever imagine, 2020, August, 3 months after the lockdown or pandemic started. And, but having said that, it was a time where people were even more reluctant to go into hospitals. And more patients were not getting the treatment that they needed. So really for us, it was like, well, this is a pretty good time to go. So that was in 2020.
So the target audience then that you are targeting is the clinician, right, as opposed to the patient themselves, or are you approaching it from both?
Initially, it was the patient. Okay. So, and this was another big lesson learned. When we created the product here, the DNA of the product was really that it was patient-facing, patient-focused. And what we found when we got to market was it was a lot easier to find clinicians. We knew where they were. We were connected into that world. We knew where they met online. We knew where they went to conferences. Much harder to figure out where are the patients in all of this. And so what ended up happening was initially we had a balance of clinicians and patients that were demanding the product. Then we started getting a whole lot more clinician interest. And what we understood from them was there were a couple things that they would want in a product, in this particular product, that hadn't been baked into it because originally it was patient-facing. So it was like, figure out what those are, figure out so we did do, if you want to call it a market segment pivot. We, for our product, we created two new aspects of it that spoke to the things that we were finding were the biggest blockers for our clinician market. And we released those features just at the beginning of this year. So it kind of feels like we're in a whole new market. We're in a whole new way of positioning the product, figuring out what resonates with clinicians about positioning that product, again, depending on what kind of system they work in. So what are their drivers? What are their directors' drivers for wanting a product like this? It's a huge learning curve.
Okay, so let's talk about other challenges. So besides the regulatory, besides identifying then who that target audience is, and that shifted a bit, what other challenges have you come across that you had to overcome that you didn't anticipate, and what were maybe some of the lessons that you learned along that journey, that aspect of the journey, I guess?
Yeah, I think, one of the biggest challenges has been finding that repeatable sales model, right? And so while it's coming and we're seeing it come, it's still something that we're working on. So that's been a challenge. Another one that maybe you don't anticipate will be as much of a challenge is just your runway. When are you going to have to raise funds? And
cash flow,
and then when you're out there raising funds, well, has its own whole set of challenges, and but I think one thing about raising a round is you sure learn about your business, because you hear from so many different people, investors who are sitting across the table from you, about why they love your business or what they would want to see different or what questions they have, and it really makes you analyze what you're doing as a company. So, some of the stuff you don't need to listen to, but there's a lot of really good golden stuff that you get from that. Yeah. So that is a challenge. I think growing a team, we have a fantastic team. Growing a team during COVID is like, okay, how do we do this? And how do we all stay sane? And how do I know what's going on with everybody? And how do I figure this out in a way that isn't artificial? So we went through a lot of trying this type of meeting, and how does that work? And like, okay, not really, let's try this, So I think we're finally in a groove of where there's the communication, this remote communication has gotten better, but that certainly was a challenge, figuring out how do we do this. So what else?
Yeah, let me ask you another question. So I'm just thinking back to some of the mentorship that you were getting through Destructive Labs. Best piece of advice. What would you say would have been the best piece of advice that you've had along your journey so far?
That is such a good question, and we've gotten so much great advice.
Yeah.
I think it probably, I don't know if it was really positioned as advice, but it was a story that we were told, where it was about how as a team you decide and you make decisions. And now you've got mentors who have a lot of experience coming at you, and they have their own ideas. And what this one mentor said to us was, he's somebody who's gone through a successful exit in his own company, and way back when, at the time on his board, there was somebody sitting there from who was part of another really big company and had this advice. And at the time, that founder was like, I don't really think that's good advice, but because of who it came from, he followed it, and he's like, we shouldn't have. Everything in the team was saying don't. So I think that that actually was really good advice for all of us, because when you're going through these growing stages and you're getting all this advice, you have to figure out, how do I weed it out and not end up with mentor whiplash?
Mm-hmm. So, I've heard that from other people as well, where it's really difficult, right? Because of just the position of the mentor and the mentee, and you think that you maybe have to take some of this as gospel, because they've been there, they've done it, but they maybe have done it in a slightly different sector, whether it's a slightly different type of product or at a different time, right? And so everything is different for every business that goes through what one would think is the same journey.
Yeah.
But it's just, there's too many variables there that are different. So trust your gut then? Is that kind of the lesson in that?
It is a lesson. And the other side of that lesson is, kind of like when you're a teenager and your parents tell you, oh, don't do that. And you still do it, and it was dumb, right? So that's the other side of that, where that's the risk, when you're like, no, we really think this is the way we should do it, and you do it. you just have to be ready for whatever comes from that. Like
Okay.
whether it's a lesson you're going to learn or if it's going to be like, oh, woohoo, we made the right decision.
Okay, so you open up the door then for this question. So what's the dumbest thing that you've done to date so far when it comes to business, entrepreneurship?
Yeah, I don't know. Well, that word dumb, I don't like that word.
No, I told you that. You're the one who brought it in.
That's when you're a teenager. Okay. I'd say that one of the things for us that took us a while to understand was, again, the market. So as I mentioned earlier, we went to market with this D2C viewpoint, and we've had good response from the D2C community, but we've had a much better response from the clinician community.
Yep.
And so, we were in a situation where, well, okay, what's your business model? Like, you probably have too many right now. And I think, looking at that, we probably stuck on that a little bit too long on the D2C side before we said, okay, now we got to pivot. And so I would say, if you want to look at a misstep, it would be sticking with something a little bit too long.
Yep.
And not just saying, okay, no, wait, cut it. We need to make a move, a drastic move. And I think some of that, again, comes down to you just don't want to make the wrong decision. But then the problem is, if you take too long, that's also the wrong decision, right?
Yeah.
You have to be speedy.
Yeah, and especially when you're talking about, like you said, the runway of financing, right? Is that the longer you take, then the more you're burning through that, and you're also losing opportunity that you maybe once had before. Yeah, and so I think that's a really interesting, I think anyway, that you went down the road of going direct to consumer when your background was very much on the clinical side, and so you knew the audience, the target audience, extremely well, that you ended up actually now trying to serve. So that was where your expertise maybe lied in terms of really identifying and understanding what that audience needed at that market. So is there a reason why you decided to go down the road of the consumer, direct to consumer, even though your background and your expertise was more on the clinical side? What was the thinking at that point? Not to hammer on the potential misstep that you said that you had, but I'm just curious as to how did you arrive at being the consumer was the person versus the clinician was the person?
The way that we got there was because our thinking was that we were looking ahead and we're like, okay, so there's going to be a whole lot of consumerism in health, right? It's all, at that point, it was already, the tide was turning towards all these type of things like Fitbits and everything. So that worked into our thinking around it, as well as the fact that, patients were going home with pieces of paper and exercises written on them, and that to us just seemed like silly. There was no reason for that. So we really felt like we wanted to empower the patient. We believed that they had the knowledge, the capability to be able to, if they can read a piece of paper and do the exercises without anything, they can definitely use this as an adjunct to their therapy. And so when we were making the device, we were very careful in all of our user testing to get the patient's input so that we made it the way that they wanted it and that it would be easy enough for them to use it on their own. And what's interesting is we find that they're really sticky customers. Like when they do find it, they stick with it. It's, so it's hard to, say, did we misstep by going down that route? Not necessarily, but it certainly is a harder, on the marketing and understanding the sales and marketing side, much harder than we ever expected.
And coming from a marketing background, what we help clients with all the time, it's definitely much more difficult to market to the masses than it is to a select number of potential customers, right? And so I would echo where you're at today makes a little bit more sense, and is much easier to enter the marketplace that way, where you're going into those people who then kind of control the buyer's journey of all these individuals.
Yeah.
And I don't know who's actually paying for it, if it's the clinic that's buying it and then somehow billing it back to the system, or
Yeah.
if they then recommend it to the client or not, who's actually making that transaction, which is somewhat irrelevant, I suppose, in some respect, besides the way that you would position it. But it is much easier than to influence one person that's going to then influence many people in the use of it anyway.
For sure. So that whole B2B2C side of things is really, where we're putting our focus now.
Yeah,
And
yeah, and it always does in the rear view, right? It always does. Yeah. Okay, so let's take a look at this device then. So
Sure.
show me what it looks like. So the massive machine.
Yeah, the massive machine is now, here's the sensor with all the, it's turned on right now. You see this little green light. It's called the mobility or mobile therapist. On the back of it, there are 3 sensors. So these 2 detect what your muscles are doing, and this one is just a reference electrode. So this essentially is replacing several quite large components that were on this big cart at the hospital. And then the phone, is replacing the big old computer that used to sit there. So the software runs in the background, and it's there's an app on the phone. This connects to the app. It's pretty simple.
Okay.
So,
well, I'm willing to give it a try here if you wanted a guinea pig to see what this looks like.
100%.
Yeah. Okay, let's
Excellent.
do it.
So you have to stick it to your face. And interestingly enough, when we were doing all of our development, the adhesives we spent so much time on figuring out the adhesive.
Oh, okay.
Like, we looked
So
at doing our own, like what's going to stick. We can't tie a band around the head to keep this thing on. It's too noisy if you try and stick it on with something else. And so we had to come up with something that would stick, that wouldn't peel skin off. We're
not crazy gluing it on.
Okay. So basically there's just like a really thin sticker that's here. They're custom made stickers for us so that they fit around the electrodes. It just fits on your face. So what I'm gonna do is I'll put it on your chin in the place where it's supposed to go, and then we can take you through a set of exercises.
All right, sounds good.
All right. So it just goes here like that. And people wonder, like, why there? That's where the muscles that start the whole swallowing chain originate, essentially. So you need those ones to be working properly for all the other stuff to work properly as well.
Okay, so it's actually really light, so it doesn't feel bulky at all so it wouldn't impact the swallowing or the movement or anything, right?
Not at all.
So how long is the exercises then? And this is a daily thing, I'd imagine, then, that people are doing?
Yeah, it's daily. And what we can do is clinicians can, when they're working in a hospital, they can set the program that they want the patient to be doing.
Okay.
And so what happens is there's a series of exercises that happen, and there's a number of sets that you would do every day. So right now we've got it baked into the system so that you're going to do 8 sets of exercises in a day. Most people, that'll take you somewhere between maybe 20 to 30 minutes, depending. But you can stop halfway through, and it resets itself every 24 hours. You get a new program.
Okay.
So there's 3 kind of swallows that you would do. And what's going to happen is you will hear this first exercise that it's asking you to do is a regular swallow. So when you're ready, you'll hit that button. You'll see a target line. So a target line is set specifically for you by calibrating the system, which we've done.
Okay.
And so that target line is one that you want to hit. When you swallow, you see the line go up, and you want to hit that target.
Okay, here
Give
we
it
go.
a try. Very nice.
All right.
100 points, 100%.
So the color of the cube then is relatively dark. If it wasn't, then that means I didn't hit my target as well.
Get your target, yeah.
And that line is the target.
Yeah.
Okay, and so I do it again.
Yeah.
And so again,
Great. Yep.
look at that. I'm a pro at this. There we go. One more. Oh, now I need another drink.
That happens.
There we go.
Okay, now this one, this is the effortful swallow. So this is where you're actually like really working out. And you have to think about swallowing really hard as if you had a big pill that you had to swallow or a big mouthful of food or something.
Okay, I'm gonna take another drink. It's funny, once I start focusing on it, it almost, my brain overthinks a little bit.
Awesome.
Okay.
So way past the line, nice work.
There we go.
The line is adjusted to be harder, even though you don't see it, it's been adjusted to make this harder for you to get past that line.
Okay. Okay, I did pretty good on that one too. I'll take another drink of water. Oh, so this one here I didn't have quite the color, so I just have a dark edge as opposed to the full one. So that means I just didn't do quite as good on that one then.
Exactly.
Okay.
So it didn't either register high enough or for long enough across there, although the next one is where you really have to think about time.
Okay.
So for this one, what you're going to do is you have to get past the line and then you have to hold it for
Okay.
as long as you can. So swallow your water, get yourself ready.
Oh yeah, here we go.
Wow,
There.
very good.
Hey.
You've come a long way.
Yeah. So in all fairness, so I had tried this once before we started filming, and it was all over the place. Like I was not doing a good job. So,
That's very good.
yeah. So I'm feeling pretty good about that one. Yeah. All right.
That one's a really hard one. It's not intuitive to
No, like nobody holds
your,
their swallow,
your
right?
larynx up. Yeah.
Yeah. Hey, what? What's going on here?
I think because you just kept holding it, it didn't fall back down.
Oh, so that's the problem.
Yeah,
I'm
you're just too good.
Yeah,
Yes.
yeah. I've broken it. I've broken the app. All right, one more time. There we go. All right.
Excellent.
And then I hit the summary button, and it color codes and tells me how well
Tells
I
you how
did.
you
then.
did. Yeah.
Okay. So then it learns then, right? So as I get better and better, then the benchmark goes higher and higher, I guess? Right?
Yes. So every day when you calibrate, theoretically, you're going to be stronger. So in your calibration, it'll take that into account. And then for that day, it'll set your baseline for a certain percentage above that calibration, essentially,
Okay.
to make it, to hit the targets that we would be seeing in clinic that you should be hitting.
Yeah.
One of the things, like if you can imagine as a clinician, what I used to do was this kind of thing would be on a big screen. You'd be sitting there doing it. I'd say, okay, you know, hold it, keep holding it, you know, and we'd sit there for half an hour or however long together doing this. And really, I mean, this is something that clinicians don't have to do anymore.
Yeah.
And I think that's the beauty of technologies like this, health technologies that do things for clinicians where we can now focus on things that are more important, like more of a value add to the patient. So, you know, I could spend that half hour talking with you about what it was like for you this past week eating. Where did you find success? We could work through something together to help you be more successful in your next week or two, sort of thing, instead of me just sitting there and doing something rote with you. And you know, I was listening to a podcast once where this woman who had dysphagia said she just wished that one of her clinicians would have asked her, like, how are you doing? How was eating this past week? And that was never where any of them went. They always went to something like this. So
Yeah.
so that's one of the dreams around technology like this, is that it can replace some of those really rote, repetitive things that
Yeah.
people can do on their own. And the other thing about this is it connects to a clinician portal. So I could now be in my clinic and I could look at what you did and I could say, oh, okay, yeah, I can see that Lance did all his exercises.
Yeah, so there's some improvement and everything.
Or Lance didn't do any exercise today. What's going on? So we've never had an objective way to measure adherence to the exercises that we send patients home with.
Yeah.
It's all based on what they come back and tell us. So this is another way to keep it real, I guess. You know, just like if you're working out at a gym.
Yeah, it keeps you honest.
Yeah,
for sure. Okay, so I mean, this has come a long way from the big machine.
Yeah.
So what's the future hold then? Because I'd imagine, as any good entrepreneur, you're trying to think through the next phases of development and challenges that you're going to overcome.
For sure. So I think, one of the things that we've always been looking at with a device like this is making it small, making it flexible. Mm-hmm. Right now, we think that this format that we have it in is great. It's something that everybody likes. No one's really had any kind of issue with it. But I think what's been really cool about it has been in our journey of trying to look at how the form factor of this, we've come up with other methods for creating sensors. Okay. And putting them onto flexible technologies. So that's one of the things for the future is around the base technology here, EMG, can be used anywhere on the body to measure a muscle contraction. So how can we get that kind of sensing into something that is somewhere else on the body in a way that fits the body, doesn't get in the way of what you're doing, say if you're an athlete or whatever it might be.
Yeah.
So that's next from the hardware side of things and the sensor side of things, where we're working on some things on the bench. And then for this product, really it's about the software. So another thing that will be part of the future for the mobility is really figuring out how to make the software smarter. Okay. So things with prediction and understanding what patients are doing when they're exercising, how that relates to their health outcomes. Where do we need to step in? Can we have a machine help us understand when a clinician needs to step in and give some advice? Or maybe the machine can alter the exercise program based on the success that you're having. So really the future will be around the software and what we can do with the software.
Oh, very interesting. So in terms of contacting you, if somebody wanted to get more information, I presume the website's the best place to go to, but you want to let us know how people can connect with you?
Absolutely. So you can get in touch with us at trueanglemedical.com. We also have an Instagram account, LinkedIn. I have a personal LinkedIn. We have a company LinkedIn, Facebook. So all the usual places. TikTok. Hey, we just started TikTok, so we did. Awesome. Yes, yeah. So we're out there. There's lots of ways to find us.
Oh, really cool. Okay, well there you have it, everybody. That's another episode of Amplify Your Business. And if you enjoyed this episode and wanted to check out a future one or the past archives, head over to amplifyyourbusiness.ca and you'll find it all there. And if you are a business who has an interesting entrepreneurial journey that you want to share, or a really interesting take on a particular business sector or industry, then definitely reach out to us through the form that's on that page and you could be a future guest on our show. So thank you. I really appreciate you taking the time today, Jana.
My pleasure.
Okay. Well, good luck with everything that you have going on in
Thank you.
This little device here and all the rest of the ones that you're going to be developing.
Yeah. Thanks very much. Appreciate it.
Okay, everybody. Take care.